Good afternoon and welcome everyone to the 70th edition of the Flint Community Webinar on Coronavirus. Today, July 16th. We're excited that you've joined us today. The Healthy Flint Research Coordinating Center's Community Webinar on Coronavirus is sponsored by the Healthy Flint Research Coordinating Center, of course, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. Again, we're so excited that you've joined us, and I'm delighted to be your host today, Yvonne Lewis. I'm the co-director of the Flint Community, of the Healthy Flint Research Coordinating Center's Community Core. And today we have a very, very exciting session for you. So I hope you've already got yourselves ready to click on that Q&A to put some questions in. Today, we want to thank our partners for joining us, and in the background, we have a number of partners that are ready to answer questions for you today. Each week, we show you this wonderful display of organizations that come to share with us. We want to let you know again today, we have representatives from the Genesee Health Systems. Katie Baxter, we're welcoming you today. Lottie Ferguson from the City of Flint. Dr. Pam Hackard is going to be with us from the Health Department. Sherelle Brown, also from the Health Department. Dr. Susan Wolford from University of Michigan and Arbor. We also will have with us in the background answering questions, Tarnisa Martin. You heard from her the first time last week, Hurley Medical Center. We're excited even to have Sharonda Grigsby from the Michigan Department of Health and Human Services with us today, Office of Minority Health. And this Jim Melanowski is here. If you have questions about healthcare coverage, he can answer those questions for you. Afton Shavers has been a great resource for us, talking about community mental health and research activities of recast. And there's another really important issue that we're going to come forward with in just a couple of weeks. And then also Gary Jones is here from the state, out of the governor's office. So they're here to answer questions for you. So we're going to ask you again, put those questions in the Q&A so that we can answer them for you. We're going to have an interaction for you today. So we want you to be ready to respond. We have a little poll we're going to do for you today. We want you to be ready to respond to the poll. Today, we're going to be talking about COVID booster shots and the variants in Genesee County. We're going to talk about FDA approval of the vaccines, as well as a little bit of update on the Flint water settlement and combating vaccine disparities and building trust to community as we look at our policy brief. So we want to start off today, as we've been for the last few weeks, starting off with Gary Jones out of the state, because there's so much information and really important things that come out of the state from our governor that we want to know about that will have implications for our conversation in the roundtable. So welcome, Gary, and we look forward to hearing your updates today.
All right, thank you, Yvonne, and good afternoon, everyone. The governor was in town recently. She was in the city of Flint. She announced plans to create a new Michigan State Park in the city by utilizing federal relief dollars from President Biden's American Recovery Plan. This would mark the first state park in Genesee County, the only county in Michigan without one. And when completed, would become Michigan's 104th state park. The governor also recently announced the Michigan Department of Labor and Economic Opportunity has been awarded $10 million in a federal grant to support the state's registered apprenticeship expansion efforts to increase employment opportunities for Michiganders. My Stars is the name of the program. It will focus on those most severely impacted by COVID-19 and expand registered apprenticeship opportunities for women, people of color, individuals with disabilities, and those without a high school equivalency diploma or an equivalent. The governor also recently signed legislation that protects the public health and safety of Michigan residents by regulating the intoxicating substance Delta-8 THC derivative that is currently being sold untested and unregulated in convenience stores, gas stores, and tobacco/smoke shops throughout the state. The governor also recently signed the school aid budget into law. The signing marks a historical moment for the state by reaching the goal of eliminating the funding gap between districts at the minimum and maximum foundation allowance that was set forth by Proposal A in 1994. The bill finalizes the fiscal year 2022 school aid budget, which totals $17.1 billion, including $85.4 million from the state's general fund, and provides cost adjustments and supplemental funding for the current 2021 year. The governor also is proposing $1.4 billion in federal child care funding in order to give working parents peace of mind in regards to the safety of their child. In her executive budget recommendation, she proposed a $370 million investment, which would expand access to no cost or low cost child care for 150,000 more families, which would also temporarily increase the income eligibility threshold of the federal poverty line, and also waive out-of-pocket copays throughout fiscal year 2022, in addition to providing a 10% increase in hourly rates for childcare providers. The governor will continue to work with both parties in the legislature to turn these proposed childcare investments into real dollars for childcare providers as well as working parents. And lastly, the Michigan State Housing Development Authority announced its largest award in recent history of more than $27.9 million in low-income housing tax credits, which will be used to construct new affordable multifamily rental housing and to rehabilitate existing properties for low to moderate income Michigan residents. And lastly, as always, michigan.gov/COVID vaccine, as well as michigan.gov/coronavirus is still both the best catch-all websites for all updates.
Thank you so much, Gary. And you touched on a couple of things that are everything's really important when you talk about money for the state residents. But when you talk about the child care issue and the school issue, I know we're going to be hearing more in the upcoming weeks about what's going on with our Flint community schools and all of our children going back to school. But it is good to know that there's some resources out there. So Gary, thank you for that update and for giving us your number. So I'm gonna make sure that people know your phone number again so they can call you with details about how they can really get specific information for themselves around these two issues.
Absolutely. So phone number is on the screen there, 517-282-3193. And also my email address as well, jonesg9@michigan.gov for any questions or follow-up information if you would like more.
Thank you, Gary. I asked that because we do have some that are listening that are by phone, so they don't see the numbers on the screen. So thank you for that. There was one other question, Gary, before we go about the My Shot to Win. Do you have any updates on that?
Yeah, so myshot2win.com, I do believe is the website. I don't have it in front of me, unfortunately, but I can put it in the chat here in a moment. And everything is pretty much laid out on that website. I do believe people are still able to register, if I recall correctly, but forgive me, Yvonne, I don't have the exact dates in front of me at the moment.
Yeah, so I know there's at least through the end of this month, folks can still apply to get those big prizes. So they need to go on that site and just make sure they understand what the qualifications are. So thank you, Gary. And now we're going to ask you to stay with us because our roundtable is coming up, and we want to ask all of our partners to join us for the roundtable. Particularly, we're looking to talk to Dr. Pam Hackard, Dr. Deborah Holden, I almost call him doctor again, Dr. Susan Wolford. We have some really, really important questions, and we're going to have an interactive poll. So I want to make sure that everybody understands we need your voices today. These are some questions that are being asked around the state, especially with everything reopening. We just want to get a sense of where people are. So I'm going to turn this over right now to Dr. Deborah. We're going to do this poll, and I want our participants on a roundtable to stay with us for a few moments.
Okay, great. All right, so the first poll question just went up. Can you all see it? Somebody shake your head if you can see it.
Yes.
All right, so how do you feel about the lifting of the COVID restrictions across the state of Michigan? Do you agree with it? Do you somewhat agree, kind of not sure, somewhat disagree, or do you disagree? Trying to get a sense of where people stand on this. And this is just your personal opinion. We won't attach your answers to your name or, you know, rat you out and say so-and-so is good with it or so-and-so doesn't like it. All right, we got a couple questions too. When out in public, do you practice safety protocols? Again, we're just trying to get a sense of where people are. There's no value judgment here. You know, do you mask? Do you practice social distancing? Are you practicing hand washing? Trying to just get a feel for where people are. This will help also to guide the conversation. Number 3, how will full FDA approval of COVID vaccines affect your confidence in the vaccine? And we're distinguishing here between full FDA approval versus an emergency use authorization. And as you know, the first 3 available vaccines in the US have all been approved under an emergency use authorization. The question is, how will full FDA approval of COVID vaccines affect your confidence? Will it increase it, decrease it? You're not sure. And then the last question is, for those who are fully vaccinated, if a booster shot became available, would you get it? All right, we got about 69% of people responding. 70, give you another sec.
So now, Dr. Deborah, while we're waiting for everybody to respond to that, can we just talk a little bit about what do we, when we're talking about the difference in the FDA approval and the emergency use approval, can you just clarify what that means again and what that process is?
Yeah, sure. It's a very similar process, and both are regulatory approvals. What an emergency use authorization does is it allows us to put a medication out in for public use or a therapeutic or some kind of intervention that hasn't met the bar of full FDA approval. The bar for full FDA approval is substantial evidence of a medication's effectiveness. You do not get to skip doing a clinical trial. You can't just develop a medication in a lab and then go to the FDA and say, hey, I think this will save lives, and then you just get to roll it out on people. So all of these drugs, whether they have an emergency use or the full FDA approval, have been through vetting, clinical trials testing, both phase 1, 2, and 3. Because the vaccine we knew would be such a game changer and would prevent people from getting sick and also prevent people from dying, we didn't want to waste time continuing to collect the evidence when we had early evidence of its effectiveness and very low harm to people. And so we get what's called an emergency use authorization. And imagine if one of your loved ones had some rare condition, rare or new, and a medication was available and they were not eligible to get that medication. That is why we use emergency use authorization, so that we don't impede medications that have strong evidence and have gone through clinical trials testing from being able to be used by people in general population. That need no longer exists. We have 3 vaccines that are now readily available. All 3 of those vaccines are in the process of getting full FDA approval. I think it would be highly unlikely that we would see a 4th vaccine that would come out under an emergency use authorization. Why? Because we have 3 vaccines already available. So predictably, any future vaccines will have to undergo the full FDA approval process, and even the 3 currently available, the Pfizer, the Moderna, and the J&J 1-dose jab, are all under consideration for FDA approval right now. And I've been told that the booster shot, a 3rd dose, will be administered under FDA approval as well.
So Dr. Hackard, thank you, Dr. Deborah. Dr. Hackard, you're our health officer as well as an MD that sees patients. What are your perspectives on both of these and the state lifting the mandates?
Well, our case numbers were very low. If you look at them, you'll see that they remain low. And at that point, with the outside availability be outside, our case numbers are low, our overall state vaccine level is over 50%. I put down that I somewhat agreed with it, because I would like to see a little bit stronger messaging to those who are unvaccinated to be wearing their masks inside, but otherwise I agree with it.
Okay, so Dr. Deborah, take us through the results.
Oh, looks like Dr. Hackard isn't by herself. It looks like the majority of people agree or somewhat disagree with the lifting of COVID restrictions across the state of Michigan. We got a few people that are still undecided. So more than half of people somewhat agree, and nearly 20% of people agree. So we've got the lion's share people saying we agree with the lifting of the restrictions. And then we've got 11% who say they disagree. And I think, this is reflective. I don't know what you think, Yvonne, of a lot of the COVID fatigue that we faced. And then it also does coincide with the fact that the numbers have gone down. So the public health person in me wants to scream, keep masking, keep this, keep that. But, we know that that's not going to be a long-term sustainable plan. So it seems like most people are in agreement with that. When out in public, do you practice protocols? The majority of people say that they do. 65% say all the time and 35% say some of the time. There's nobody in this group that says I no longer practice any of the protocols. And again, the recommendation for people, because we have, and we're still just compiling data to understand the presence of this Delta variant in our community, which seems to spread more easily and also cause more harm. Dr. Hackard made a great point around masking, especially when she's around children. Why? Because younger children aren't even eligible for the vaccine yet. I still maintain if we could leave this pandemic more mindful about hand washing, about touching our face, about our practices when we're out in the community, we could actually prevent the spread of many, many communicable diseases. And we would see differences in flu and other things. So, I just encourage people to continue to be mindful and keep some of those good practices in place. We just saw Dr. Hackard gave us a great example of how you sneeze, by the way. I saw that, Dr. Hackard. She didn't even have to think about it. It was automatic and real fast. Okay, how will the FDA FDA approval of COVID vaccines affect your confidence in the vaccine? So we know this is the group, this is like the choir. So 89% said, I already got the vaccine. This will not change my confidence. Nobody is in this group said, I plan on getting it once it's FDA approved. So FDA approval for a group that has been highly engaged and highly informed doesn't seem to be a game changer. Smaller percentage of people, 8% said, I'm undecided about whether to get the COVID vaccine, even with the FDA approval. And just one person said, I will not get the vaccine, even if it's FDA approved. And I will say, if you look and compare these numbers to what you see in the nation, we're much more in favor of a vaccine independent of FDA approval compared to the general population. The general population numbers are substantially higher. We still have about 40% of people who are a no or an undecided with the vaccine, and that's independent of FDA approval status. Again, just a testament to the good work of this group and being good, credible messengers and giving people information. And then the last thing, for those fully vaccinated, if a booster shot became available, would you get it? The majority said, yes, I would, 76%. We've got 14% still undecided and 11% that said, no, I would not. And I'm hoping we're going to talk about that with some of our physician colleagues today about the booster, why that's being brought to the forefront now, and what that means for people. And we might check in and ask these questions again in a future webinar after people have got more information.
Thank you so much, Dr. Deborah. And that's a great segue because we don't have that great demonstration today. It's coming next week. But I do want to offer Dr. Wolford a chance just to chime in here about boosters.
Well, I'll just say thank you, Yvonne. And we'll at least offer a more in-depth description next week. But this week, I just wanted to spend a little time thinking about why people might delay and want to wait till the booster comes out. Because I keep hearing that people are thinking, well, why get it now if we're going to have to get a booster anyway? And as I thought about that, I was thinking, what's an analogy for that? I mean, why would people why would we do that? And it came to me, it's much like, say it's winter and you want to buy a coat and you decide to order a coat. You buy a nice warm coat, and it comes with a lining, an extra lining that you can zip in and out to give you that extra boost. You might say they arrive at different times. You get the coat, but the lining doesn't come for another couple, 3 weeks. Are you going to go out in the snow without your coat? I think not. You're going to put on your coat, and when the lining comes, you will add that on. but you wouldn't go out in the cold waiting for the coat. It's waiting for the lining. You have the coat already. Why not use that effective coat? It's like shoes. Who doesn't like a good pair of shoes? We know they're going to wear out. We know the bottom over time is not going to be as protective, but we don't not wear them because it's going to wear out. We wear them, and when they wear out, we take them to the cobblers, the shoe menders, to try and fix them, or we buy new ones, better ones are out, but we wear our shoes. And so I'm saying we should use our vaccine. And I think the only reason why this conversation comes up of delaying for the booster is because of concern about adverse or bad effects. And that is because of a lot of misinformation, right? We know, and I know everybody on this call, we're all the choir, so it's just so that we can take this out to those who are not at the service today and share with them. But we know that it's more dangerous for us to get in our car today than it is to take that vaccine. We still get in the car. We hear about accidents. We hear about all those other things. We still go and drive. And we just have to fully inform ourselves and inform others that the risk from this vaccine is so small. Yes, the media shows all these stories here, but they don't tell you about the millions and millions of people who've had the vaccine and are now protected and therefore are not ending up in the hospital, in the ICU, dying from this. And so that needs to be our message. Don't wait for the booster. Get the vaccine, and if and when the boosters come, then that's another step for extra protection.
Thank you, Dr. Wilford. And we are going to have some more conversation and a little bit more demonstration next week. And I chuckle because with the difference in context and culture, shoe menders. I just love that.
Well, you know, in England, we call them cobblers. But the funny thing is that word also means a bunch of nonsense. And so it means a shoe mender, but it also means a bunch of nonsense. And I was thinking of that phrase this week about all the things that people say about the vaccine being bad and so on. It really is lots of nonsense. Yeah.
So there is a lot of misinformation that's already out everywhere. I was talking to a young man yesterday, and he said he heard about one person that died, so that was why he wouldn't get the vaccine. But you mentioned to us today that we should actually get in the car. And one way to get in the car, I'm going to try to use a little bit of that. One way to get in the car is to actually go to where vaccines are available. I see Clarence Pierce on, and I want him to talk a little bit about what's happening in Hamilton. And then Dr. Hackard, I want to come back to you before we talk more in detail about what's happening with the outreach from the health department this week. But Clarence, you're one of the locations that allows and provides vaccines all across the community. So can you talk to us a little bit about what Hamilton is doing? You mentioned some things earlier today.
Yes, Yvonne, we still have our mobile clinics 3 days a week at 3 locations, at North Point on Clio Pearson Road, at our main location there at 2900 North Saginaw, and in Burton at the fire station. So we're still doing the drive-through mobile clinics there. But we also do the in-clinic sites. So anyone who is unable to get a ride or don't have transportation can come into one of our clinic locations and get the vaccine. We have noticed a significant decline in the numbers, Yvonne, and that is concerning. We do have the Pfizer vaccine now for kids 12 years and up. And we hope to be able to reach out to more young people and start to focus on them and get them in for vaccines. But it is concerning that we have so many people who, for whatever reason, hesitant about getting the vaccine. And like you, I've talked to some of my young relatives, grandkids and that, and they have this attitude that I really don't need it, that, you know, I'm healthy and I mean, I just don't need to get a vaccine. And, you know, I don't know how you get through that because they're pretty adamant. And, you know, the more you try to convince, the harder they take their stance. And so it's difficult. So I'm hopeful that as time goes on, you know, we'll be able to reach them by celebrities and other people saying they have gotten the vaccine, and maybe that will be enough to convince them to get it. But they really dug in. I was surprised how dug in that some of them are. But you know, we're doing everything we can in terms of the social media. We're doing the radio ads. We're doing regular TV ads. And we plan to continue this right on through August, September. We hope to be able to actually start integrating flu shots along with other vaccines that kids need, because we're coming into August, and that's when all the kids are going to need their vaccinations. And so we're going to be really hitting hard on that message and trying to get the kids in, not giving up on the adults. I mean, we're going to still reach out to them as well and do everything that we can to encourage them to come in and get vaccinated.
Thank you, Claire. So that was a great segue to you, Dr. Hackard, because I know the health department is constantly working on the multiple vaccines that are available, but particularly schools coming up, and nice to know what you as a health officer would share with our community.
We definitely are trying to target school groups, make ourselves available with anyone who has requested us to come out and do a vaccine clinic, and also bring the childhood vaccines with us at that time. I did want to just add one more thing to Dr. Wolford's. So when she had said, I was trying to think of an example, well, I also was trying to think of an example, and my example was, you know, coming from a little bit different health background, meaning I had a lot more work to do with my own personal health. My analogy to why not get the vaccine sooner was a diet, because when I would say I need, you know, I'm going to go on a diet, I'd say I'll start Monday. Well, Monday never came because, and then by the time Monday did come, I probably had put on a pound or two, and that would be like the analogy of like, why don't wait to get your vaccines now because you're going to get a booster, because it may just be using it as an excuse. And so, you know, I changed my whole way of thinking, and I said, all right, if I floss my teeth and exercise every day, I'm going to count that as a good day, no matter what. And, you know, so I changed that perspective, and I lost like 5 or 10 pounds a year for many years. And so I would suggest that there are different ways of looking at it, and don't use the fact that there's a booster may or may not be coming as a reason not to get the shots now, because we know they are so effective even against these variant strains, and particularly the 2-dose series is incredibly effective with 2 doses fully in. Even the 1-dose Johnson & Johnson is still going to prevent death and hospitalization. And so I really do urge everyone not to wait for boosters, because there's a very good chance that boosters will not be recommended for someone who is not very elderly or immunosuppressed. And then you've wasted all that time. You could have been doing just a little thing of getting the shot in your arm now, and you're protected all the way through.
Thank you, Dr. Hackard. And for our team today, we know that there are a lot of questions about the vaccine. A lot of people still are a little bit hesitant, and in some cases quite hesitant, and in other cases, they've just decided they're not going to do it. So we're just encouraging those of you that are participating in the webinars to be armed with information. So should you get the questions asked of you, you're able to give an answer that will allow people to make an informed decision. That's our goal, that our community is in a position to make informed decisions. And so thank you to the panel. In order to help us make informed decisions about where we can go and what's available to us, Sherelle Brown, who is also from the Genesee County Health Department, is going to give us some specific updates on what's happening here locally for us to get the vaccines and to learn about other opportunities. Sherelle.
Good afternoon, everyone. I just had a statement to make. Mr. Pierce said that someone mentioned that they weren't going to get the vaccine because they heard of a person that died. And I would just like to ask the question, well, did you hear about the millions that died from the COVID-19 virus itself? Let that be a thought and a reason to motivate you to get the vaccine. So you won't be one of those million compared to that one. And in Genesee County today, we have administered over 320,000 doses of the COVID-19 vaccine within the community. We continue our efforts every day, and we want to see you out to get your vaccine. Right now, we are still seeing less than 1 death per day in Genesee County. As of now, the Delta variant is not present in Genesee County, but it is present in all of our surrounding counties. So that's even more reason to protect yourself. We saw a 10% raise in cases in the last 7 days, and cases are still going up. So it's important to protect yourself. And if you get a shot, then you can enter My Shot to Win, which is the Michigan lottery for those who have gotten their vaccination. And we've also found out that if you received your vaccination through the VA, some of those vaccines were not registered. So if you visit Genesee County Health Department's website, gchd.us, you can click on COVID-19 information, and there will be a link with the link for you to click on to get registered if you either were a veteran or you received your COVID-19 vaccine out of state. So make sure you go on there, get registered so that you can also enter the lottery if you received your vaccine. Next slide, please. And as I mentioned before, we are continuing our efforts to get our community vaccinated. So next Tuesday, we will be at Our Lady of Guadalupe from 10 a.m. to 2 p.m. where we'll offer Moderna and Pfizer. And again, on Wednesday at the Central Church of the Nazarene, where we'll offer Pfizer and Johnson & Johnson from 9 to 12. And then we'll have an evening clinic offered on Thursday at Shiloh Missionary Baptist Church. You can come between 1 p.m. and 6:30 p.m. We'll have Moderna and Pfizer available. If you have any children 12 and up who have not received their vaccination, we ask that you bring them to one of those clinics. They are walk-in, and we're still accepting names and addresses for those who are homebound so that we can get them vaccinated too. Next slide. And so I mentioned our positivity rate being 1.9%. So of those who are tested for COVID, 1.9% of them have come back positive. So it's important that we continue to get tested so that we can track the variant and track our cases. In the community, we have these sites available, your local Rite Aid, your local Walgreens. You can also visit some of the urgent cares, the Genesee Community Health Center, as well as the Hamilton Community Health Network. And then we have Word of Life Church, Bethel United Methodist Church, and Macedonia Baptist Church still available to get your COVID-19 testing. If you're having any trouble with figuring out how to locate a vaccine, please do call us at 810-344-4800. We'll point you in the right direction. And you can also use that number to help get your loved ones registered who are homebound. There is no appointment, and we hope to see you walk into one of those locations and get your vaccine so you can be one of the ones who survive.
Thank you so much, Sherelle. And I know you're out at some of those sites making sure that this is available to our community. So we want to, again, express to everyone to make sure that the information is being made available. And we appreciate what you're doing to help us make this difference. So thank you so much, Sherelle. We have had a lot of conversations in the last few weeks about what it means with the testing and the variants. And so I want to go now to Dr. Deborah. We had a little bit of a conversation, and I wanted you to just take a minute to explain something. When we talk to our community about the importance of getting tested, You mentioned earlier about, and I think Dr. Wolford mentioned the variant as well, especially the Delta variant. We don't really know. I mean, we're hoping that we don't have the variant in our community, but can we be 100% sure?
No, you can't be 100% sure. And if I had to guess, we likely do have the variant. If not in our community, it's close. It's in the state of Michigan, that we know. We've done, again, a really good job. So I want to make sure I kind of put it in perspective. We've done a really great job at slowing the spread and, substantially slowing the spread of this virus in our community. We had about 10 weeks of consecutive decline. And then 2 weeks ago, we had our lowest numbers in Flint. We had only 2 cases in the city of Flint. And then last week, that number jumped up to 8. And I always tell people, we got to just sort of put it in context, right? Because as an epidemiologist, I could have said there was a 400% increase in cases, but I would rather just give the whole numbers. It increased from 2 to 8. And lo and behold, we find out that many of those cases were clustered in a household. And so it really does underscore the importance of people continuing to do their part and know that we all matter. All it would take is for one family to travel and bring the variant back to this community, and we would have it. Once it's here, it's here. I've used the term endemic to talk about, we now know what epidemic is, right? So there's whatever disease you would expect in the community. And when you get above that, we call it epidemic. And when that happens in multiple places across the world, we call it a pandemic, a worldwide epidemic. Endemic is just how much disease there is in a population, and it's almost expected. So now COVID is become endemic in our population. So we're going to have to learn how to live with it and learn how to really master these mitigation strategies so that we can keep spread down. To that end, the work that we did last week, our cases did drop from 8 to 3 in Genesee County, and I don't remember the exact number. Go back just one slide real quick. And they dropped went up a little bit from 21 to 26 in Genesee County. And you can see that the testing positivity rate went from just below 1% to now just under 2%. Let me tell people what that means. What that means is that of the people who are getting tested, at the peak of this pandemic, we had 20, 22, 23% of people who were getting tested who were testing positive. As those numbers go down, we still keep good testing in place, and the percentage of people we would expect that test positive to be really low. Some people are just getting tested periodically as a function of their exposure. So all of these metrics are pointing to things are still pretty good here, but it really wouldn't take very much for things to sort of potentially balloon out of control again. And prevention is our best strategy. Please, please, please continue to practice good protocols. When you're out and you're in large crowds, you should be masked, especially if you don't know the vaccination status of the people around you. And don't underestimate the potential that you or your household could have on bringing these variants to our community. We know we have cases in the state of Michigan. We don't have, I'll tell people, confirmed cases in Genesee County. And the reason why is because when people test positive for COVID, some percentage of those tests are sent off for sequencing. So, every like we all have a social security number, these different variants all have a genetic profile. They have a genetic sequence. And so we can get that profile, but that's extra testing. It's extra cost. So we don't test every single COVID case. We send off a small percentage of the test to the state, and then they test some percentage of those cases. So if we keep the numbers low, likely we won't see many Delta variants in our community. As those numbers start to go up, what's predictable is we'll start to see variants in our community as well. And that's just sort of the snapshot picture. We were going down, we're going up just a little bit, but keep that on scale, okay? So notice that scale on the bottom is a 5. And so we've been hovering around, 5 cases, give or take a few each week over the last 5 weeks. This still remains good news. And this just, to me, underscores the need for ongoing surveillance. We just, and I really appreciate the work of the health department in the local hospitals and really keeping their finger on the pulse and being transparent and sharing and reporting that data to us. All right, I guess I'll talk a bit about vaccines real quick. We're still creeping along at a snail's pace. We now have about 52% of the adult population 16 and over received their first dose, and just over 21%, 12 to 15, got their first dose. The fully vaccinated numbers, they're just simply not moving enough. And I really appreciate our group and Dr. Sadler and his great team and our partners at the health department for breaking this down by race. You know, it was important for us early on to get the people who were most vulnerable vaccinated and protected. And we've done a pretty good job of that, right? You can see the vaccination rates tend to go up, whether we're talking about first dose or fully vaccinated as people get older. But we've now learned a lot. We've got pediatric deaths from this virus right here in Flint and Genesee County. We've got plenty of people who, you know, were the person in their household who, you know, may have been in their 30s or 40s and didn't have many symptoms, but they infected a spouse who then had to be hospitalized or who died. And so I just encourage people, be that voice with your people and encourage people to get vaccinated, especially these younger populations. The average age of COVID hospitalization and death is decreasing. So we're seeing people getting sicker and dying younger from this disease. So that's my encouragement for people. I'm going to pass it over to my colleague, Mary Catherine.
Okay, great. Thanks, Doc. So I'm going to go ahead and just kick us off there and say we are eager to provide you guys with that breakdown of vaccine rates by other demographics in the coming weeks. So make sure you are signed up for that health equity briefing. But right now, to build our numbers, we really need policymakers to work with public health institutions to do this the right way with community input and needs being heard. So one way we can enhance these relationships is by facilitating, bi-directional communication with the community in public forums or Zooms or any kind of setting like that, so that we have different leaders of these spectrums leading and listening together to promote the uptake of what we know is the best defense against COVID. Gary brought up an example of how the state is moving to use science and evidence and regulating these various THC substances to protect public health. And unfortunately, I'm going to address a recent bill that actually puts public health at risk. So House Bill 5086 actually undermines the use of evidence and best practices and actually aims to require doctors to tell patients undergoing a medication-induced abortion that they can stop a pregnancy termination process and reverse it despite agreement in the scientific community that this is not a medically or scientifically backed practice. In fact, there's actually data that illustrates where these laws are implemented or have been passed, that they erode patient-physician trust, they undermined the process of informed consent, and really just violate the First Amendment speech of physicians and commitment to the Hippocratic Oath. So we're really hoping this does not go any farther. That's all I have for today.
Well, thank you, Mary Catherine. I appreciate your updates today. I want to just go back to Dr. Deborah. You were talking about vaccines. We have a couple questions in the queue that are specific to this. And Dr. Wolford or Dr. Hackard, you may also want to respond. But one of the questions, one of the actual statements is they've taken the FDA, they've taken one of the vaccines, a Pfizer vaccine, and would be willing to take a booster, but not willing to take the Johnson & Johnson. It seems like a 50-50 draw with the results from this vaccine and having COVID. Both has the ability to cause death. Help me with this opinion I formed.
So I think that's a really great point. Okay, so the first thing I'll say is, Dr. Reynolds always says, people would say, oh, the information is changing so fast and You know, da da da. Like, how often should we expect changes? And I think he said twice a week. Expect updates twice a week. And of course, that was just an answer just to let people know we all gonna have to stay nimble and grow in our knowledge, right? And so we also grow in our recommendations. But the difference with this kind of format is we try to give people some context for those recommendations. So when we were in a period of scarcity, you know, I knew that we would have problems getting the vaccine to people equitably. Why? Because we have a problem getting every resource to people fairly and equitably. So the vaccine I knew would be no exception. So if you had asked me earlier in the pandemic, what vaccine should I get? The answer that I had is the one that's available to you. And at the time, that was the Moderna or the Pfizer vaccine. We are no longer in that phase. We are in the phase now where we have more vaccine, so we have more supply than we have demand. So my answer to that question is now different. People say, what vaccine should I get? I say the one that's available to you and that you're comfortable getting, because we do have more choice now and people do have the choice. Do I personally believe that the J&J vaccine is especially harmful, et cetera? No, I don't. I'm monitoring and I'm trying to stay abreast of, you know, what's happening. I'm not getting my information from most of the mainstream media, because the things that the mainstream media chooses to highlight are more the exceptions and very, very rare exceptions. And what sells papers is these extreme events. And so people are hearing more about those. And like Dr. Wolford said, not the millions and millions and millions of people who benefited from just having to get a one-dose vaccine, who did it basically without incident. But if that is a barrier for somebody, and if in your heart, because this is your health, you know, and I couldn't make a recommendation for somebody because I'm not the captain of somebody else's health ship. They are. So if in your heart you don't feel comfortable getting the Johnson & Johnson, no problem. Get the Pfizer or get the Moderna. The key being, get vaccinated. That's the most important thing, that people get vaccinated. And because we do now have choice, get the vaccine that you feel most comfortable with. That's my recommendation for people.
Thank you. One other question with respect to vaccines. This is a nutritionist who's been a part of this, and this is why it's so important, because they're talking to people all the time. She's received calls and emails from people that reach out daily of questions regarding the COVID vaccines. Her question is there anyone having conversations on how important it is to prepare your body for the vaccinations, like increasing certain foods in your diet? Increasing certain foods in your diet, etc. So what about the nutrition component?
So I think I saw that Dr. Hackard was answering that question online. So I don't want to jump in ahead of her, but I would say that even without any preparation, just taking the vaccine, your body is given a fighting chance to learn how to protect you from the COVID-19 virus. So even if you didn't prepare yourself in any way and just took the vaccine, that would make you safer. Now, however, do I think it's a good idea to have your body and your immune system in the best possible shape it could be? Absolutely, and which is why I've talked on this webinar about the many different things we can do to keep ourselves healthy. Make sure that we're eating everything green that we can come across. Well, that's not true, but eating fruits and vegetables, drinking water, getting exercise, trying to maintain a healthy weight, getting the right vitamins and minerals. All of those things are very important for our overall health and for protecting us from any number of illnesses. And so it certainly wouldn't hurt. But even if you don't wait, as Dr. Hackard just mentioned, don't wait to get all those things in place before you get the vaccine. Get it as soon as you can and as soon as you feel comfortable doing so.
Thank you so much. Righty. Dr. Deborah or Dr. Hackard, did you have anything to add?
No, I completely agree with that. The different means that were listed in there to boost your immunity will help you fight off any infection, and are all great ideas. However, I do have a little concern if the vitamin E supplementation is actually via pill. You want to get vitamin E from foods, since your body cannot utilize all the different forms of vitamin E in supplements. But it doesn't. I've not seen anything that preparing your body for the vaccination would necessarily make a difference in how effective it is for you, because it's actually triggering the antibodies directly with the vaccine, and you're not being infected with anything. So, those are all great things to prevent infections in general, and I encourage them all. However, for the vaccinations, get the vaccine.
Yeah, can I just add one other thing to that? I think it's great, and I always like to let the physicians go first with these medical questions. One of the things we've been advocating for is that people really do take the reins of their health. And so some of the things that we're talking about, as the docs have already said, there's no evidence or any data that substantiate that they would improve vaccine side effects, but they will, improve and help boost your immunity. This is just, again, I think about, what if we learned during COVID that if we brought that forward, right? Like I remember when we used to, run in the house, my mom would make us wash our hands before dinner. Like that came from somewhere. Like at some point, and it was probably the flu pandemic of the 20s, we learned the importance of hand hygiene. And so people started, washing their hands before because literally people used to eat with their hands. So they would wash their hands before they ate, so that whatever was on their hands, they weren't putting in their mouths. We've learned a lot in this. And I'll go back to those 3 basic recommendations that have been giving people, since this pandemic started, to just boost their overall immune system and to support their overall health, which is practice good sleep hygiene. Sleep. The second one is eat the highest nutrient-dense diet that you can afford. Nutrient-dense foods tends to be the ones that don't have labels on them, right? So it's a bag of chips versus an apple. There's a lot more nutrition and things that are good for your body in an apple than there are in a bag of chips. And on the back of the bag of chips, what you're going to see is all the fat and the sodium and all the other stuff. You're not going to see a label on an apple, but if you look it up online, you're going to see fiber and vitamin C and all kinds of other great things that are in apples. And then the last thing is movement. Move your arms and legs for 30 minutes every day. You don't have to go to the gym. It's a beautiful Michigan summer. You can walk in your community. I tell people I mop my floor like no one's watching. I turn the music on. I throw my back into it. Just 30 minutes mindfully of moving my arms and legs, trying to practice good sleep hygiene, and eating the best high nutrient dense foods that I can afford. If people are doing those things and seeing a primary care provider, your primary care provider will help you backfill gaps. My primary care provider told me I had got to that age where it was time for me to add a vitamin D supplement. And I'm like, what age would that be, lady? But it was that age. It was that age, right? And guess what happens? I start to do what my doctor tells me. I take this vitamin D supplement, and she told me exactly, she didn't tell me the brand, but she told me how much I needed, right? She told me how much, and I didn't do the least. I didn't get less. I didn't take more. I took exactly what she told me. And within a few days, I noticed I had a bit more energy. I thought, wow, this is really interesting. So those are the main things. Like, let's just all take the reins of our overall health, practice those 3 things. Think about what you've learned in COVID that you can now institutionalize in your own health and your health habits for you and your family, and make sure you got a primary care provider.
Thank you, Dr. Deborah. And Dr. Susan, I saw you come off your mic. I'll give you 30 seconds.
No, I just want to echo that. I think it's so important. COVID is one thing we're fighting, but there are going to be other things, and there are already other things. And we do not treat our bodies as though they are precious. They are completely precious. So be very careful about what we put into it. And I just love the idea that people are going to the nutritionist. We should learn so much more from nutritionists and dietitians, because it's all about this we only get one. We can buy many cars, but we only get one body. So following the advice of a dietitian and nutritionist to keep ourselves healthy is a phenomenal thing to do.
Thank you so much. I appreciate you all coming back for that little mini roundtable based on the questions from our participants. And so we're going to go to Lottie Ferguson now. We have an update from the city of Flint. Lottie, welcome.
Good afternoon. It is good to be here. There's 2 things I want to say quickly. One is, Dr. Susan, your analogies are always amazing. I want to write them down and spread them across all of Flint because they're amazing. And then second, Dr. Deb talked about making sure people eat the highest quality food that they can afford. And I really like that clarifier on the end that people can afford, because we all know that not everybody can afford to eat organic everything. And also everyone cannot afford to pay the high water rates that we have here in the city. And so we want to continue to encourage you to pay your water bill, as much of it as you can afford. Simply ignoring the water bill does a couple of things. It increases your water bill, even though we're not doing any shutoffs right now, but your water bill will continue to go up. And then also, it helps the city out. It helps us remain solvent. So pay as much of the water bill as you can afford. The opt-in deadline for service line replacement is coming up fast next Friday, July the 23rd. If you need to opt in, you can call 810-410-1133. You can also go to the City of Flint's website and fill out the information to opt in. Also, if you are having current problems right now, I know there's been a lot of talk in the news about water main breaks and issues with sewer. If you have specific problems, you can call us 24 hours a day, 7 days a week. For water specifically, 810-766-7202. That's if you're having problems with water pressure or other issues. And for sewer, 810-766-7079. There were questions at a previous discussion around the water main breaks that have been happening, specifically in the Court Street area and other places in the city. Please know that if a boil water advisory is needed, the city will absolutely call one. In the cases of these water main breaks, it's not a complete break. It may just be a fissure, boil water advisories are not in effect right now. If you have any questions about anything related to what I've mentioned, you can give us a call at 810-410-2020, or send me a message in the chat or a question, and I'll do what I can to answer in the next 3 minutes.
Thank you so much, Lottie. You got that in the next 3 minutes, because you know we got to get out of here right at 1 o'clock. Lottie, just wanted to say thank you so much. And we're going to have a special guest with us next week from the city of Flint. Can you just tell us who's going to join us next week?
Absolutely. Absolutely. You will get to hear from the fantastic Michael Brown, who is the director of our Department of Public Works, DPW department. A lot of people have not met him yet. He is not the Michael Brown that you remember. This is a completely different guy. And he will be here to talk to you a bit more in depth about water and what's going on with service line replacement and the secondary water source, and lots of other fun things that I am having the pleasure to learn about from him right now.
It's like I tell people all the time, we know more about water system, water chemicals than we ever thought we need to know.
Great.
But we're happy to know that, and he just shared, he's got extensive background, and he is a former resident, was born here and raised here in the city of Flint, so has a real passion for what's happening. So we wanted people to know he's going to be here with us next week with those questions that you've been asking us. He's going to be able to respond to some of those questions. So we'll look forward to him being here with us, and hopefully you'll be back here next week to hear the responses to the questions that we told you we get the answers for. So thank you so much for sharing those. Today, we're just about out of our time today, but we want to encourage our social workers and our community health workers to continue to apply for the social work contact hours and the continuing education units. It is because you asked that we're able to do this, and we certainly appreciate Michigan State University for supporting us in this effort, along with the Michigan Community Health Workers Association. We want you to always remember that you can join us and support us by liking us on Facebook. Anytime, I understand that you may want to have more information or you want to go back and review these, they're on YouTube, so you can subscribe to our Healthy Flint channel. Email us at any time at info@hfrcc.org. We'll be happy to answer questions for you, to give you information that you might need, or call us at 835-2130. Again, that number is 835-2130. I want to again thank all of our partners, our panelists today for being with us. I've got comments already that the extraordinary information that's shared today was so helpful, and we appreciate it. So continue to keep those questions coming in. Panelists, thank you so much for your participation, and we'll look forward to having everybody join us next week for the Flint Community Webinar on coronavirus. Thank you for participating today.